I'm going to be quite brief actually, because we've already talked quite a bit about some of the things that I was going to cover in my few slides. So I was just thinking about the future of cancer survivorship care, and I think one of the things that we really need is a greater understanding of how to prevent, how to detect and how to treat these long-term and late effects of treatment. And if we can use these molecular methods to work out who's maybe more susceptible to get certain late effects, then that can tailor the treatments and so on. We need more personalised and tailored care, I think, which we've talked a lot about already. And we really need to see this integration of psychosocial care, so it's an integral part of the cancer pathway, because that's just not happening at the moment. And aligned with that, we need better coordination between all the different elements, between tertiary, between secondary, and with primary care, because again, there's lots of room for improvement there. And I think, as was mentioned earlier, we're looking to see more care being delivered out in community settings. That's definitely the direction of travel. So, and that, along with that increase in the supported self-management we've been talking about. And also, I think we're wanting to work towards better ways to prevent and detect recurrence. So how do we get there? So obviously, I think resources are important, not only for services, but also for research. And in research spend terms, the amount of money that goes on cancer survivorship research, as opposed to, obviously it's very important, early detection, diagnosis, treatment's very important, but survivorship gets a really, really tiny percentage of the budget. And I think that needs to be looked at if we want to make real strides. Collaboration and interdisciplinary working, I think, is really important, and there's too much working in silos, and people could learn so much if they got together and put their heads together to come up with the big ideas. We've talked again about routine collection of PROMs, and in the UK there is now pilot testing of what's called a quality of life metric. So they are trying collection of routine quality of life data through the hospital systems to see how that goes, with a view to rolling that out. So watch that space. Obviously, we need to harness technology and all the many advances that, people in the cancer registries now, that the opportunities for data linkage are increasing all the time between the registries, with treatment data, with inpatient data, and then with community data. So looking to the future, there's so much we'll be able to do there. There's also using technologies like augmented reality, AI, and I'll come on just to mention a little project we're doing. And as was mentioned, the whole thing about digital interventions and apps really has to be the way forward, I think. And also implementation research is really important, because once we've we do research, we find something that works in a group of patients, but it just seems to take ages to get it out there and get it implemented and get it embedded. So I think there needs to be more investment there as well. And again, effective patient and public involvement all the way, so that we are developing interventions that are actually what patients want and think will be useful, because there are lots of examples of interventions that aren't useful to patients. I just wanted to give you a little example of something we're doing at the moment. We're trying to use augmented reality to promote exercise in people living with and beyond cancer. This was an example of interdisciplinary working. We got together with our techie guys. I didn't even know what augmented reality was, really. But obviously there's increasing evidence of the benefits of exercise in improving quality of life and reducing risk of recurrence. And that works well and is well received in hospital settings, but it's how we get that happening out in the community and get people exercising more and confident to do it. So we thought, how about trying to use augmented reality to encourage that? And for those who don't know, augmented reality is really where you get computer-generated images which are superimposed over a real-world view. So it's a bit different to virtual reality. So in the thing we're doing, the people wear these goggles, and the avatar asks them to give their information, and then they get a set of tailored exercises, and AR shows them how to do the exercises. So we're piloting that at the moment, and I was a bit worried whether people would take part, but they're all really enthusiastic, and it's being very well received thus far. So that's the sort of thing I guess we're going to see more of, that will help deliver things in the community. And just you're not going to be able to read this, but this was really just to say that in the UK, there's recently been, the NCRI has undertaken this priority setting partnership. So I don't know if you've heard, do you do James Lind Alliance in Ireland? You may do, I'm not sure. But anyway, it's where they get health professionals and patients together, and they sit down and go through this process for working out research priorities. And they've come up with this UK top 10 living with and beyond research priorities that I thought you might be interested to see. And I think this is going to be used to try and lobby some of our cancer funders to put a bit more money towards cancer survivorship research. Okay, thank you.